Hello and welcome to the After Our Skin Clinic. I'm Dr. Emma Craythorne, a consultant dermatologist, and this is the Laid Back Skin podcast, where I get to share all the stories and answer all of the skincare questions after the clinic doors have closed. But now quickly, just while I have your attention, if you're enjoying these episodes of the After Our Skin Clinic and what we stand for, then please make our day and subscribe. Because we're just starting out, it really helps us grow and to be able to reach more people. And it would mean the world to me and Ellie to have your support. Anyway, enough of that and let's get on with the show. So today, Dr. Ellie Rashid's back with me. Hey, Ellie.
Hello.
And she's just in time for Valentine's Day.
Yay.
I thought we could do this about all of the problems that might happen with your skin and all of the skin concerns that people might have in the run-up to Valentine's Day and maybe the day after Valentine's Day.
Yeah, a few weeks after Valentine's Day.
Should we start with the run-up?
Yeah, let's start with the run-up. So Valentine's Day prep.
Okay, so we're thinking maybe shaving in areas that are otherwise maybe not shaved every day?
Yeah, shaving, waxing, and all that prep that goes into like going for a nice date. I often find that patients will then say that they've gone a long time sort of not having shaved or not having waxed, and then they've gone to have their shave or their wax done and everything has just flared up. So they've got these shaving bumps, they've got these spots that have come up, the waxing has taken off a layer of their skin and they've got like almost like a burn on their skin. The whole thing's sore, red, inflamed. Absolutely not what you want. The other thing is when people use those like epilation creams, like feet, and then you just leave it too long and then you can get a proper good going burn from having done that, not speaking from personal experience.
I once had a patient as well who'd been telling me how she epilated, and I don't know if you've ever used an epilator, but essentially grabs onto the hairs to pull it out.
Yeah.
And whenever she'd use the epilator, she then just didn't have the courage to do it anymore at all and just was like, I just can't do it. And she had the epilator then attached to her until she had somebody to be able to come and help her unravel all the bits of it. Because body hair is actually really important. We have our body hair really for a reason. You know, in the genital area, it's acting almost like a little protective cushion to protect our genitals from the outside world. So it makes the microbiome pretty nice and, you know, it keeps everything as safe as it can possibly be and reduce infections and the microbiome going out of kilter. But it's quite fashionable and in many kind of cultures and societies required to shave or remove the body hair or keep it short. But it does cause some people some issues, doesn't it?
Yeah, completely. It's quite hard work. It's quite a lot of maintenance that's required.
Just laser it all off.
Perfect solution.
First of all, let's think about the ways in which you can remove your body hair. You can shave it off, you can wax it off, you can use creams that are put onto the body hair. Typically, you need to go for the ones that are for a sensitive skin area. Some people might find the one that you'd use otherwise in your legs a little bit too harsh in the genital area. And you can also laser it off.
Or you can just clip it with an electric clipper or something, just keep things short rather than sort of removing altogether.
But sometimes it causes those little nicks or breaks in the skin. And sometimes if you're waxing, it can actually lift off bits of the skin itself.
Yeah.
And then sometimes when the hair starts to grow back in again, that can be really itchy for people. So they'll scratch it and then that'll break the skin again. So I think what we're talking about here is when you've removed hair and it's become a bit of a problem and because it's itchy, it can be a bit painful. You've got breaks in the skin and those shaver's bumps.
Yeah.
What do you do?
So you normally have a feel of how you respond to those different types of treatment. So most people will know that if they were to shave completely, maybe they'd get a shaving bump. So they might just use an electric clipper and just keep the hairs short rather than shaving them down to skin level. If you're on certain drugs, then you might be more likely to take a layer of your skin off when you're doing a wax. For example, some of the vitamin A drugs like Roche-Posay, your skin is a little more fragile. And so doing a wax or using some of these epilation creams could result in sort of a little bit more fragility of the skin. So if you are getting any problems, I normally would recommend an antimicrobial wash of some description, or maybe a wash that's got some salicylic acid in it if you're getting those little shaving bumps. Sometimes I'd recommend using an antibiotic lotion. So something called clindamycin, or Dalacin T is the brand. If people are getting recurrent shaving bumps and folliculitis, where the hairs are growing back through the skin, it sort of curls in on itself and you get inflammation of the hair follicle, then you might want a course of sort of oral antibiotics to try and help reduce the likelihood of that and reduce the inflammation that you're getting. But there are ways to sort of avoid getting that in the first place. So as you say, using the sensitive wax strips, even, for example, they just don't have the same sort of pulling power. So they're just a bit gentler on the skin. And using the sensitive creams, the depilation creams as well.
Yeah, I think as well, if you are somebody who gets repeated shaving bumps, shall we call them, or where the hair has become very coiled up and stays inside, creating almost like a little kind of wormy thing inside these little bumps that can be very itchy. And sometimes for some people, if you scratch them, can turn into scars. So you then end up with a problem with the shaving bumps and then the shaving bumps turning into scars. So I will often say, if there is somebody who keeps getting these repeatedly, despite trying all of these methods, then usually if you're wanting to have no hair or short hair there, then really laser hair removal would be the thing to do, because then you don't have to keep going through this same cycle every time you want to have your hair short or shaved off. I think it's a much better way of dealing with it.
Yeah. Do your patients ever ask you about if they change their mind about the amount of hair that they want to have and they've had laser hair removal? For example, the pattern.
Well, this is a very interesting thing.
It is.
Yeah. I've been removing hair from patients for many, many years, decades. And it is interesting because you see the pattern and the fashion of how you should have the hair in the genital area.
And things change.
And things change, you know. You go from Brazilians to Hollywoods to full bush. You have the whole lot. But as fashions change, with laser hair removal, you can't go back in time. We never say it's a permanent hair removal, but you should regard it as such, because especially in the genital area where the hair is typically coarse and dark, and that's just perfect for a laser device, a coarse dark hair, then it's really very effective at clearing hair in this area. So you do have to be fairly mindful that, you know, you
can predict the decade that they've had it. Which era did you have your
It's a bit like cosmetic surgery. You can like see which decade they had the cosmetic surgery done. And the appearance of the hair in the genital area is exactly the same. So yeah, practice does change, but you do have to counsel the person on that.
Totally.
Because you might decide that you want to keep all your hair there and actually you've made the decision 10 years ago to laser it off and it's not coming back.
Nope. Sorry. Bye-bye.
I think one of the things as well is whenever you're having laser hair removal, because it is a bit inflammatory in that area, and then once things go inflamed, it can then disrupt the skin barrier a bit and you get that dryness that goes alongside it. It's probably really important to make sure that you are moisturising that area well. I also think that, you know, while you've got a lot of hair there, that's also trapping moisture and keeping the area kind of more humidified, shall we say?
Yeah, well, it does, of course, yeah.
So it is going to dry out. Do you have particular creams that you recommend to your patients?
Yeah, so I'd probably just recommend something like Lipikar. So the Roche-Posay Lipikar Balm, AP+M.
Plus Emma. That's what my kids say. There she goes again saying that.
Elle as well.
Oh, Elle, yeah.
Elle.
Like it. I also like CeraVe. It's nice and plain, easy to put on.
Their moisturising lotion, lovely, easy.
The QV cream, but my probable favourite to recommend, partly because the name suggests that you might want to be using it there anyway, is Vanicream.
Yes.
Because it sounds like Vanicream.
Yes.
It's really lovely.
But it's actually just a really nice moisturiser, Vanicream.
It's an amazing moisturiser. Super moisturising.
Yeah,
it doesn't have lots of fragrances, perfumes, etc. in it. And so it's a real go-to. Vanicream.
Yeah, Vanicream for your...
Vanny. Okay, so that's one thing in the run up to it. So top 2 tips to think of if you're, loads of hair and you want rid of it and Valentine's Day is tonight.
You probably need to prep a little bit before, is what I would say.
Yes.
Rather than doing it just before. So you want to maybe get a few sessions in of clipping, shaving, waxing, whatever you want to do, just so that you haven't got that sort of long-standing, very coarse, very thick very dense genital hair that you're then trying to manage sort of the day before Valentine's Day.
The skin is clean. You're using a nice, if you're shaving, you're using a nice clean razor blade. If
oh my God, of course.
Well, you say of course as if that's, but some people are just like, oh, it's Valentine's night tonight. I'm just going to grab the razor that's here. This needs to like go. And actually that's where you often will see problems because, there's lots of undulating areas in the genital area, isn't there? Yeah. So you got to be careful with any blade that's going to be
Maybe take your time as well. Sometimes people do it in such a rush and then they're just nicking the skin and then that's when you get problems. Yeah. Take your time.
Enjoy it.
Put some music on.
And I would say don't put anything fragrance body cream or anything like that on afterwards. Not immediately anyway, because the skin is definitely going to be more sensitive after hair removal. Okay, so we're all prepped.
That's covered. All prepped.
All prepped, ready to go. One of the other things that can sometimes happen is if you're not somebody who's used to having removed all of your hair before, once you have removed all of your hair, you might notice things on your skin that you hadn't seen previously. You might notice that your skin is darker there than expected.
You might notice some mole that you've got there that sort of you hadn't been aware of from before.
Or sometimes as well, the little cysts that can occasionally appear and are very normal in this area, or areas of redness that you might have had from a dermatitis that you hadn't really realised. But I think people are often a bit struck whenever they see what the skin looks like in this area, because typically it is darker because you've got folds of skin folding in on itself. So always the scrotal skin is darker, always the skin of the labia majora is darker. And sometimes that's a bit surprising for people.
The other thing that people notice when they've removed their genital hair is how prominent some of their oil glands can be.
Yes.
So the prominent sebaceous glands, they're called. And they can look like these sort of round yellow bumps, but like sort of sheets of them because they're all over the vulval skin. And I've had patients that have come and saying this, I think there's something wrong. And actually you look and it's completely anatomically normal and it's just prominent sebaceous glands in the area. So yeah, sometimes it can like unmask things that you may not have been aware of that have always been there or always been the case. And sometimes you get problems as a result of shaving, waxing, all of those things. And when things are red and inflamed, particularly if you have a darker skin tone, then it tends to leave you with like a brown mark that just takes months and months and months to then resolve. So normally for that, I just recommend to use a regular moisturiser. It will resolve, but to leave the skin dry just means it might take longer to get better. So just use a moisturiser, not dry the skin out in any way. Use some sort of soap substitute like the Roche-Posay Sin Det, which is usually my go-to, or like one of the CeraVe cleansers, another go-to.
Yeah, I think that's right. And then if there happens to be something that you are worried about, particularly if it's a patch. So if something is in a well-defined patch, whether that's a red patch or whether it's a brown patch, then, that is something that probably needs to be shown to a doctor. But differences in skin colour in that area are actually very, very, very common. And just while you were talking about the sebaceous glands in the genital area, you also get glands around the nipples, well, actually on the areola. And I've had many people come in thinking that these were abnormal little cysts and they needed to be cut out. Have you ever had that?
Yeah, it was one of my first ever private dermatology consultations where someone had come in saying there's something really abnormal going on. And you do have to take things on breast really seriously. And if you're worried, you have to get it checked out. But this was completely normal, just these little glands on the areola called Montgomery glands. Absolutely nothing to worry about, but they just can look prominent in some people.
The reason why they have developed is because it's a little bit like Braille for the newborn child. So they're able to detect out where the nipple is. And this is these little glands sticking out almost act as a little tracking map for that little baby to work out how to latch on. That is why they're there. So you definitely don't want to cut them out or, they're definitely there to be celebrated, these little bumps. The same with hair around the nipples is also very, very normal.
Really normal.
Nipples are something that we really don't, I think, get educated that much about. And most time you see a nipple on TV or a nipple in a magazine, it's like this perfect nipple.
Yeah, airbrushed, exactly.
Often the actual nipple itself is very coarse and rugged on the surface of it again, so that the milk is able to come out. And then having hair again is all very normal, but easily lasered off if you didn't want the hair there.
Back to laser.
Back to laser.
When I first got together with my husband, I was very conscious of being without makeup on. And so as soon as I woke up in the morning, literally like 6 a.m, straight in the bathroom, put a full face of makeup, went and laid down in bed again.
You did not, did you?
I really did. Morning. Just wake up like this. Because actually, I don't think it causes that much harm. People worry about it so much. But I think if you're doing it consistently, it's an issue. But if you're just doing one off, like, no one cares.
We know that if you leave your SPF on, for example, overnight, those filters kind of start to degrade. And there's a thought that that could cause some oxidative stress on the skin. And likely the same thing with makeup will cause a bit of oxidative stress on the skin. And some of the makeups that we use are, especially a lot of the primers or some of the eye makeup, they often hold the skin in a fixed way. And therefore it can be a little bit abrasive on the skin whenever you're sleeping on it because you're moving against this thing that's fixed. So they're the two of the reasons that I can think of. I'm not a makeup expert. I'm thinking as a dermatologist that might be a bit irritating and essentially inflaming of the skin. But to do it like once every so often, I mean, that's totally fine. Now, what kind of dermatology conditions can happen after a date night, after Valentine's night?
So the thing that we come across as dermatologists is what we refer to as Pash Rash.
Pash Rash. Have you ever had Pash Rash? I know the answer to that. That's why I'm asking the question. I think we all have.
I think everyone gets a Pash Rash to a certain degree. So Pash Rash refers to when you get irritation on the skin. Sometimes you can develop little spots on the skin, redness, flaking, usually a result of friction, or if the person that you're intimately kissing has got facial hair, then that can irritate your skin. And then you get a dermatological rash as a consequence of that.
Somebody has to, in the partnership, has to have a beard typically, or not even a beard, which often gets a bit softer, but it's the stubble.
Stubble.
It is short, sharp stubble on thick hair. I mean, that is
on your delicate, gorgeous
retinized skin.
Exactly.
So that is probably the worst combination. Somebody who's been diligently looking after their skin with their retinoids, and then you have a short, sharp, stubbly, handsome face. And that combination creates the Pash Rash, which can last for quite a wee while afterwards, a day or two. How do you treat it?
Stop kissing. Encourage them to shave their facial hair. No. I think if someone gets it, then I normally say step back with your skincare routine, maybe cut out some of the actives that you might be using for a couple of days, just whilst your skin recovers. Use something really gentle, like, for example, the Toleriane range by Roche-Posay. They've got a lovely gentle cleanser, nice moisturiser. Whilst your skin recovers, then you can start introducing products again.
Yeah, that's what I would say as well. Just deal with it. Enjoy it.
Yeah. Have a lovely time.
It's a trophy. Put on your moisturising cream and don't put any actives on, because essentially those little stubbly bits will have created these micro dermabrasions to your skin. And those abrasions will let any actives in a little bit more readily. So if you're using acids on it, for example, then it will just really hurt. So just think of it as a very brisk exfoliation and just moisturise for a day or two thereafter.
Yes.
I mean, I've seen as well some patients who come in and we've given them a treatment for their skin. So I'm thinking if somebody has a lot of sun damage and they have something called actinic keratoses, which are these very small, red, slightly crusted lesions. Often they'll appear on the scalp of men, down the sides of the face in somebody who's had a lot of sun exposure over the years. And they are considered to be pre-cancer lesions, although the chance of them becoming a cancer is incredibly small. So they're called actinic keratoses, and they're incredibly common. Most people in Australia, for example, over the age of 40 have one of these. So we see them commonly, and the best treatment for them is something called topical 5-FU, or Effudix is the brand name that we typically use. It's a topical chemotherapy agent that's targeted, goes to these little actinic keratoses and gets rid of them over a 4-week period. But you put this on typically at night time. And I have seen on many occasions, not just one patient, on many, many, many occasions, where the patient will have come back and they said, oh, it's cleared mine, but my husband or my wife had this terrible reaction in her face. And it's because the cream has been put on, there's been kissing and cuddling happening in bed, and there's been the transfer of the cream, and the other person's been treated at the same time.
Perfect. 2 for 1. Both patients happy.
So we do see that with quite a few
They
creams.
just need to keep it going for the whole 4 weeks, though. They can't interrupt it.
Yeah, just a single episode doesn't quite work. Other actives sometimes just don't taste very nice if you put your skincare routine on at nighttime.
Yeah, or smell very nice. Sometimes your partner's just like, oh, get away with me with that smell. They don't like it.
Have I told you what my friend Amy calls her klira?
No.
So she's so diligent with putting her klira on. So klira is her nighttime cream that she puts on to support her skin, and the name klira essentially to make everything clear. But if you taste the formulation that she has, it's a little bit tingly on the tongue. It almost tastes like, I don't know, like an acidy kind of taste. But her partner has renamed her klira Clear Off. So when she's putting her klira on at nighttime, he's rebranded it to mean to him to clear off. So she has now changed her routine, and she will just have her klira to put on just before she goes to sleep.
And add it to the list of excuses. It's like, I've got a headache tonight. Oh, I've just put my klira on. So, sorry. My skin.
Keep it by the bed until you're ready to go to sleep rather than as part of your nighttime routine.
Yeah. I do my klira actually quite early on in the evening.
Do you?
Yeah, because I do all my cleansing and everything sort of early in the evening, and then I can just do my skincare routine. I quite like taking my makeup off when I get home. Then I've done it and it's done and dusted.
Yeah. Do you brush your teeth then as well?
No, because
but what happens if you
game? I need to snack when I'm on the sofa watching TV.
I thought you said your sack game. I was like, what is that?
Wow. It's Valentine's Day special.
This is getting very raunchy.
We should probably talk about things like cold sores.
This is the herpes virus, and it presents, most of us carry this virus, really.
Yeah.
Most of us are exposed to it in childhood, and typically it comes up as usually a small, round, disc-like lesion with tiny, tiny little vesicles, or tiny, tiny little blisters, in other words, right on top of it. And it lasts for around about 10 days, and they can be pretty uncomfortable and painful.
Yeah, and also they don't look particularly nice as well. So people don't like the look of them either.
And you get them really from close contact, as in kissing.
But most people get it in childhood from their mums kissing them.
Yeah.
Or their parents kissing them.
Did you get a cold sore?
I've never had a cold sore.
You not?
No, never. And actually, I asked my husband if he's ever had a cold sore. He's never had one since we've been together. And I was like, have you ever had one? Do you carry the virus? And I was like, yeah, but like when I was a kid. Damn it.
Exposed.
Yeah, exactly.
So if you're somebody who is prone to getting lots of them, or if it was, say, just before Valentine's Day and, you've got a cold sore coming up, there's not really much you can do to get rid of it that quickly. But there is oral antivirals that you can take if you kind of ideally get it within 2 or 3 days of the cold sore starting. Yeah. You can take either acyclovir or valacyclovir. And if it's one that's really, really inflamed, something that you think is quite counterintuitive, but it's actually putting a bit of a pretty potent topical steroid on top of it. So you can do the potent topical steroid and the antiviral. You can ask your GP for that.
I normally say if you think you've got a cold sore coming and you're prone to them, you've got a bit of tingling around the lip area or on your nose, then to just straight away pick up your topical acyclovir with Zavirax. Not everyone will need to take the oral antiviral treatment, but it's exactly as you say, it's the quicker you treat it, the better. And it just really narrows down the length of the episode. So if you were going to have a cold sore for 10 days, it might narrow it down to maybe just a few days. So that's the real advantage. And it doesn't sort of keep going where those blisters will then burst and then you get the crust over the top, and that's the thing that people don't like the look of, is when you've got that sort of crusty lesion over your lip.
Yeah, because there's nothing you can do about it. You can't cover it up with makeup. But one thing that I think is really helpful, you can get these cold sore blister covers, which are made from hydrocolloid, and they are they're made of the same things as these zit sticks or spot covers that you can get really quite readily now. Pimple patch. And to have one of these, not with anything on it, just the plain hydrocolloid to cover up the cold sore. Yeah. It does two things. It helps it to heal, doesn't it? But it also probably reduces the risk of spreading it around because those viral particles are trapped behind that blister cover that you've put on it.
Yeah. Just need to be careful not to actually put a pimple patch because sometimes they've got like salicylic acid in them.
Yes, tea tree oil.
You don't want to put that ingredient over. Ouch.
That would be so sore.
No.
That's a wrap for us now at the After Hours Skin Clinic, and thank you for joining us. And in the meantime, why not say hi on our social media and send in your questions, big or small, that you'd like answers to. The kind of questions that you're probably asking your friend or your friend's sister, if your friend's sister happens to be a dermatologist, like everyone asks my sister. So we're actually here now to answer those questions. You can find us at Instagram at After Hours Skin Clinic, or you can email us at ahsc@raconteur.tv. Also, did you know you can find us now on YouTube too? Just search for After Hours Skin Clinic, and all of that information will be in the show notes. Wherever you find us, please do leave comments, reviews and likes, and please don't forget to subscribe. Okay, bye for now, and take care of yourself and your skin, and remember to wear your SPF. See you next time on the After Hours Skin Clinic.